The Affordable Care Act, or Obamacare as it's commonly called, mandates penalties this year of $300 to $600 for people without health insurance. Thankfully, most people qualify for low-cost or even free health insurance with government assistance through the healthcare exchange system. To see if you qualify, call our healthcare exchange hotline toll-free at 888-226-9599. If you don't sign up now, you will face a penalty and can't sign up again until the next open enrollment period. Why wait? Get insured now. Call today and let us navigate you through the process. We can make the process quick, easy, and painless. There are no fees and there is nothing to lose. Get insured. Call now. 888-226-9599.
Okay, we'll go ahead and get started. So today we're going to be walking through how healthcare reform affects CPAs, accounting, and tax professionals. So if you are a tax professional on the phone, ideally you're going to get a lot of the information out of this webinar. I can't cover it all in 60 minutes, but you will get an email after today's presentation with a link to a copy of this and a recording, as well as detailed overviews of each of the key, I guess, tax components of healthcare reform. So be on the lookout for that. But I'll try to give you enough information to at least get started becoming an expert. As you probably noticed with the marketing of this webinar and the landing page, we believe that CPAs, tax professionals, tax advisors, if you are involved in an employee's or an employer's tax decisions, you're going to become a very important person in evaluating health care come 2014. And this is not a transition that's happened overnight. It's something that's been in the process for a long, long time. Quick disclaimer, this information provided is for informational purposes and it's general in nature. So if it's not intended as legal or tax advice, I have to say that. But it should give you a good idea of where to go. So you people that are able and licensed to give tax and insurance advice can do so with some of this information. As far as an agenda, we're going to walk through a couple of things here. I've got, I apologize if I start jumping around because I'm really excited about this content. I've spent a lot of time myself reading the different regulations and trying to understand the macro viewpoint of, or the macro evolution of employer-sponsored health insurance. So I want to share that with you today. First, we'll walk through, though, what tax advisors need to know as an overview. I believe tax advisors are going to turn into the new health benefits advisors. Notice I quote benefits versus saying health insurance. Health insurance, in my opinion, and a lot of experts agree with me, is going to turn into health benefits, more healthcare reimbursement. And that's going to be a theme for the webinar. So I'm not saying brokers, health insurance brokers and health insurance sales are going away. I'm just saying that the tax, from an employer's perspective, when an employer is offering benefits, the tax advisor or CPA is going to be the go-to person now for benefit decisions versus a health insurance broker. The health insurance broker is going to be the go-to for health insurance decisions. But as you'll see in this webinar, the health insurance decisions are going to be made on a consumer and individual basis in coming 2014, while the employer is going to concern themselves with mostly tax and budget issues. All this will come together through the webinar, hopefully. But here's the agenda. We'll walk through a quick overview of what the tax advisors need to know. Well, in order to understand how you fit in 2014 today as a CPA or tax advisor into the healthcare reform piece, you have to understand the history of employer-sponsored health insurance and how that leads us to the future and what I believe to be healthcare reimbursement versus health insurance. Understanding the core problem. If you understand the core problem, you'll realize that cost is actually the big problem here. And even without healthcare reform, we're going to be moving towards a consumer buying their own health insurance policy versus an employer providing health insurance to their employees. Healthcare reimbursement via HRAs is likely going to be the future of healthcare or employer-sponsored benefits come 2014. Even without 2014, we're already going down that trend. I'll explain why. And then we'll go into detail on the healthcare reform must-knows for tax professionals. And as part of this, I'll be outlining some new opportunities for tax professionals with more expertise and more reliance on tax advisors. You're going to be called on more, so that should provide a new opportunity for you to generate revenue for your business, as well as help businesses learn. So tax advisors. All right. So I'm going to go through these slides, and I'll try not to go too fast. If you have questions, please type them into the question box. I'll try to pause every now and again just to get an idea of what everyone's thinking and make sure I'm addressing any issues up front. So as employer health insurance shifts to employer health benefits, I'll explain why I think why we think at Dane Benefits think that's going to happen. There's going to be new opportunities for tax advisors. I believe tax professionals are going to become the new healthcare benefit advisors. Starting in 2014, you're going to have to be able to evaluate tax advantages of new tax deductions, credits, and subsidies for health insurance and health care for businesses and individuals. We'll walk through these deductions, spend most of the time on the credits, subsidies, and penalties, and then we'll walk through these in detail. But if you're going to understand, if you're going to help a business in 2014 and you don't know what tax credits and what tax subsidies and what tax penalties are affecting them, you're going to be they're going to lose faith in you. And on number two, and then secondly, if you're working with individuals, an individual has a lot of tax penalties come 2014. Here's a couple of overviews. First, you're going to want to know what medical expense health reimbursement arrangements are. In other words, HRAs. I believe they're going to be the future of healthcare. I'll show you why later in the presentation. But you're going to want to know what these are and how to help a business establish one in compliance with the applicable regulations. The key employer tax issues are going to include the employer tax penalty for not offering qualified health insurance, the employer tax credit for not offering qualified group health. The employer tax credit. This is a small business healthcare tax credit for offering qualified health, and then the employer tax penalty for offering qualified health insurance that is not affordable. All these definitions I'll explain later in the presentation, but these are the key tax penalties and credits that healthcare reform brings along in 2014. The key employee tax issues include the following. The employee tax subsidies on the individual market. These are absolutely massive, and it's amazing to me that no one is talking about these subsidies. Just to give you an idea, and I'll walk through an actual example later, a family of four making less than 88 grand gross income is going to have their health insurance capped as a percent of income. Basically, let's just say that the cost of health insurance for the year is $20,000, they're only going to have to pay a small percentage of that. I think it's 9.5% of that, whereas the government's going to kick in a tax subsidy to cover the rest. So huge tax subsidies available to individuals based on household size and income. We'll walk through that. Additionally, for individuals, if the employee decides not to buy qualified health insurance, they are subject to a tax penalty, and that tax penalty is based on their household size and income. All right, so in order to understand why you're in this position come 2014 and why you're going to be relied on more and more for healthcare benefit decisions by employers, you have to understand the history of employer-sponsored health benefits. Great. So in order to understand the future, you got to understand the history. So for those of you who don't know, the creation of employer-sponsored health insurance is less than 80 years old. In the 1940s, around the World War II time, is when employer-sponsored health insurance, this idea of employers paying for employees' medical care, started. So pre-World War II, there was actually very limited employer involvement. Health insurance was very catastrophic in nature. If you did go to get medical care, you went to local Blue Cross Blue Shield, and the market was very individual and family-driven versus employer-sponsored. What happened was World War II happened, and wage and price controls were instituted by the federal government to avoid wartime inflation. As part of a concession to employers, the the federal government exempted employer-sponsored health care from this income taxes. What these wage and price controls essentially did was they raised income rates at the high levels to up to 90%. What that meant was that if you were making above that threshold, each dollar that you took home after that, 90 cents went to the federal government, you took home 10 cents. So what the employer said was, please let us pay for employees' medical care and let us deduct this as a recruiting and retention tool. So they passed a exemption for employer-paid health care, basically employer-sponsored health care, and planned on removing that when wage and price controls were lifted after the war was over. Of course, as you know today, this deduction still exists, so they never removed it. And what this did was it created a huge cost advantage to the employer health care system. In other words, health care paid by the employer through the employer was tax deductible, whereas health care paid for by the individual or health insurance paid for by the individual was taxable. So employers started offering health insurance. So from World War II to 2002, group health insurance enjoyed huge tax advantages over individual health insurance. Essentially, employers were allowed to pay for group health insurance off the books. What we mean by that is they didn't have to pay it. Employees did not have to pay income taxes on it. The employers could record the payment as a business deduction. They didn't have to pay wage taxes on it. And starting in the 1970s, they created Section 125 of the IRS Code to allow employees to pay for their portion of the premiums via salary reduction with the same tax advantages. So in 2002, we started seeing a lot of problems in the health insurance market. Small businesses said, I can't afford this anymore. They shifted costs to the employees and eventually said, hey, this is too expensive. So they started dropping group coverage. So the federal government decided to give tax parity to individual policies. In 2002, they created health reimbursement arrangements for employer tax-free contributions to individual health insurance. So what this did is this is under Section 105 of the IRS Code. We'll spend more time on this in a little bit. They let employers set aside money that employees can use to reimburse, sort of like a business expense account, their out-of-pocket health care needs tax-free. Individual health insurance is actually one of those reimbursable items, so that individual health insurance can be deducted. And then in 2009, they created premium reimbursement arrangements, which basically they proposed new rules for Section 125 of the IRS Code for employee tax-free contributions. Essentially, what this does is it gave employees the ability to set aside money on their payroll pre-tax to reimburse their own out-of-pocket individual health insurance. If you're familiar with flexible spending arrangements or flexible spending accounts, very similar, but without the uniform coverage provisions. Anyway, this is what, if you're hearing this buzzword in the marketplace, this is the idea of defined contribution health benefit. So when someone's talking about, hey, I want to offer a defined contribution health benefit plan, they're talking about an HRA or a PRA. Now the catch is, in 2014, PRAs are probably going to go away because PRAs cannot be used in the individual health insurance exchange. However, HRAs can. So employers, we expect employers, and I'll explain this in a little bit, to start offering HRAs like crazy to reimburse employees for medical expenses. More on that later. So if we look at small business health insurance today, just as a snapshot of employers offering health insurance, less than 50% of small businesses offer group health insurance. And this is by cross-listing the Kaiser study that you see a picture of on the left here, and with the census data. And we find that basically the majority of small businesses don't offer health insurance. Number one, because the cost is too high. If you're not familiar with small business or employer-sponsored health insurance, for your information, health insurance companies, they say, in order for me to give you a group health insurance plan, they require the employer to meet certain minimum contribution requirements. So if the premium is $500 per person, they require the employee or the employer to contribute no less than 50% of the minimum contribution amount. So if the employer can't afford the minimum contribution account, which in that example is $250, they have to cancel coverage. So costs have gone so high that the employers the smallest businesses can no longer afford the minimum contribution, so they drop health insurance coverage. The other reasons given in the study are the firm size is too small, That's typically because participation requirements aren't being met. In addition to minimum contribution requirements, these group health insurance plans have minimum participation requirements. What that means is if 50 to 75% of the employees choose not to participate, then the group health insurance plan can be canceled. So once costs get really high and the employer is at the minimum contribution threshold, the cost for the employee is really high compared with an individual policy. So a lot of times the employees will drop off the group plan and go buy their own individual policy because it's cheaper, and what that does is it puts the employer or the small business below the participation requirement, and the group health plan gets canceled. There's other reasons that companies don't offer health plans, such as maybe they have employees in multiple states and can't find a policy that fits all of their employees' needs, or a lot of times the administrative hassle associated with a group health plan, even though they can afford it and they can meet participation requirements or size requirements, they can't, the cost of offering it from an administrative standpoint is just not worth it because their turnover is too high. Overall, we estimate there's about 3 million businesses today that do not offer group health insurance. And it's not that they don't want to offer group health insurance. They do. It's that they don't know how they can because they think that the only option is group health insurance. And as we just discussed, there's new options available, namely HRAs, that can help these employees get the same tax deduction. So what's the future of U.S. Employer health insurance come 2014? We're going to spend a lot of time on healthcare reform today at the end, but pre-2014, here's what the current market looks like. There is medical underwriting on individual health insurance, meaning if I'm on individual in most states and I go try to buy a policy from a carrier on the individual market, they can deny me coverage or increase my premium based on my individual health. So if I'm an employee of a company that does not offer health benefits, there is no such thing as guaranteed issue in the majority of states on the individual market. This prohibits employers from dropping or switching to HRA-type coverage that can afford group health insurance because some employees may not be able to get health insurance on the individual market. Additionally, today there are no federal subsidies for individual health insurance policies, so there's no tax subsidy available at a federal level for employees on the individual market. And we saw this employer-driven market. Here's what happens in 2014 when the majority of health reform pieces go into effect. First, the medical underwriting on the individual market is removed. And that's going to make it so that employers don't have this moral obligation necessarily to offer group health insurance. So all employees, no matter what state they're in, are going to be able to go to the individual market and get health insurance coverage. The health insurance carriers cannot deny them coverage based on any criteria. The federal subsidies, additionally, we create federal subsidies for individual policies. So if you're an individual and you buy health insurance on your own and you meet the income and household size requirements, then you qualify for a subsidy for your individual policy that caps the cost of your health insurance as a % of your income. Huge, huge incentive. What this is going to cause is a very individual and family-driven market because of the huge cost advantages to the individual. There's no medical underwriting from a moral perspective, and then these federal subsidies for individual policies are going to create a major cost advantage to the individual system. The additional piece here is that, as we just talked about, HRAs are going to allow employers to maintain the tax-preferred or the tax deduction for employer paid health care without them having to offer employer-sponsored health insurance. And that's where we're going to spend a lot of time today on the webinar. So just so you guys know, I'm not making this up, and I encourage you to take a look at this study. It's from June 2011, but still to date, I think it's the best study done on healthcare reform with all the history taken into account. So here's it's by McKinsey. It's called How U.S. Healthcare Reform Will Affect Employee Benefits. Here are the key takeaways. U.S. healthcare reform sets in motion the largest change in the post-World War II era. So for the past 60 to 70 years, this healthcare market has been it's been reformed slightly over the years, but we've been very employer-driven. This healthcare reform bill, starting in 2014, is going to create the biggest change in the health insurance industry since that World War II era. Based on the survey that they did, 60% of educated employers plan to pursue alternatives to offering health insurance, including what they call defined contribution. Defined contribution is another word for HRA, or health reimbursement arrangement, which is nothing more than a tax vehicle for medical expense reimbursement. More on that later. The parallel that everyone is making is the shift to 401ks. So if you've been around for pension plans in the 1970s, you saw those switch to 401ks. In other words, moving from a defined benefit plan where the employer buys or commits to a defined benefit to a defined contribution where the employer says, hey, here's what my fixed cost is. You go choose how to spend it however you want to. So like a 401k lets an employee spend their own investment or retirement dollars and invest it on their own. The defined contribution HRA for healthcare reform allows an employer to say, hey, here's your money. You go choose the best individual policy for yourself. I'm no longer in the health insurance business. I'm out. And that's where the CPA and tax advisors are going to come in. They're going to start advising on the health reimbursement arrangement, while the health insurance brokers meet with each individual employee and advise on the individual health insurance decisions. So more on HRAs later. But I want to talk about the core problem. Everyone that's on this webinar that's disagreeing with me, let's just throw healthcare reform out for a second and just talk about the core problem. The core problem is that health insurance costs too much. It's going up at a rate that's crazy, crazy, crazy. And most brokers, if you're a broker, don't like healthcare reform because it squeezes your compensation, and maybe you disagree with the political viewpoints of how this is being done. Regardless, look at how fast health insurance expenses are growing. In 1999, a single employer-sponsored health insurance premium, the average was $2,196. Today, it's $5,429. That's almost a 3 times increase over the last 12 years. Wages aren't going up that much. Sales for the average business aren't going up that much. They can't afford this increase. So they're going to have to cut benefits. What have they been doing for here? They've been shifting all these costs to the employee. So all these increases over the year, they're shifting the cost to the employees, and today they're almost at that minimum contribution level. What the most that they can afford, but what the insurance company is going to say, hey, that doesn't meet the minimum contribution requirement, therefore I'm going to cancel you. So regardless of health care reform, employers are going to drop health insurance eventually at the current rate. Now, if health insurance costs on the employer basis start going down, come talk to me. But it doesn't look like that's going to happen anytime soon. The key thing to remember with any employer-sponsored health care program, whether it's health insurance or HRA, is that employers offer health insurance for one basic reason, and that's recruiting and retention. A lot of times I ask people, why do companies offer health insurance? And a lot of people say because they love their employees. I used to have a presentation on this that said, it's not about how much they love their employees. The main reason a small business offers health insurance actually is for the small business owner himself, because he can't get health insurance on the individual market. Secondarily, it's for recruiting and retention purposes. It's a compensation package for employees to hire the best employees and keep them from going to the competitive employer. Tax-free compensation is valued at up to two times the value of taxable compensation. So as long as there's a tax deduction for health insurance or employer-paid health care or reimbursed medical expenses, employers are going to be in health benefits because it's a form of compensation. So today, remember, employers offer health insurance for recruiting and retention because, one, it's tax deductible to business, so the tax advantages. Two, employees get the benefit 100% tax-free from income taxes. And individual health insurance today, the reason they offer group health insurance versus the HRAs is individual health insurance is not guaranteed issue in most states. Come 2014, this moral obligation of guaranteed issue is going to go away. But regardless, eventually the costs are going to catch up with employers, and they're going to have to cancel health benefits. And what they're going to transition to are medical expense reimbursement plans via HRAs. Essentially what this lets an employer do is define an amount that they can afford and say, hey, this is tax-free. It's better than me paying you money, increased salary. Go buy your own health care. This is the most I can afford. And it's going to be competitive because all the employers are going to have to do it. So what is a health reimbursement arrangement versus health insurance? What are the key differences? With a health reimbursement arrangement, there are no minimum contributions. So the business determines its own contribution strategy. Second, if you compare that to a traditional group health insurance model that brokers are selling to your clients right now, the employer must contribute 50 to 75% of the premium. there's a required minimum contribution. If the employer can't meet that minimum contribution requirement, the plan gets canceled, and the employer can't offer group health insurance. With HRAs, there is no minimum participation requirement. The business is going to set its own eligibility requirements. What that essentially means is, if they want to, if they only have 2 out of 10 employees participating, they don't get canceled. Whereas with group health insurance, there's a minimum participation requirement. 50 to 75% of the employees must participate. If they fall below this threshold, the plan can be canceled, and the employer can't offer health insurance. The reason I'm calling attention to this is because eventually the costs are going to be too high for the employer to afford even the minimum contribution. And even if they can afford the minimum contribution, if the employees can get cheaper health insurance on the individual market, they're going to drop off the group plan and the participation levels are going to suffer. So the likelihood over the next 10 years, with or without health care reform, of employers offering health insurance at the rate health insurance costs are increasing is not very good. Additionally, health reimbursement arrangements eliminate this administrative hassle. The unfactored cost of offering health insurance today from a business perspective is astronomical. Astronomical. You know what I'm trying to say. The point is they have no administrative hassle on the HRA. Effectively, they can administer this reimbursement program with payroll in less than 5 minutes per month. Instead of offering health insurance and hiring HR people and a full staff to manage these plans and compliance pieces, they get out of the business. They say, hey, my business is selling widgets. I'm going to pay you money for your job here, and I'm going to pay you tax-free money for any medical expenses up to a certain amount that you can afford. All this is going to be calculated on your payroll run, and you're going to get one check for working here. Really, really simple administration. Compare that with group health insurance, and you've got ongoing paperwork, annual renewals, dedicated staffs, and a lot of administrative hassle. The reason I make this comparison, so you're probably wondering, I signed up for healthcare reform webinar, not a sales pitch on HRAs. I'm not trying to sell you. I'm trying to give you a reason to get educated on this stuff, because businesses are going to start understanding what HRAs are. They're going to start transitioning to them, and then all these tax penalties with healthcare reform, all these tax subsidies are going to be extremely important for you to be able to calculate very quickly for your clients, because most businesses are going to decide to pay the penalty versus offer health insurance come 2014. So a little bit more on healthcare reimbursement arrangements, and then I'll switch to the healthcare reform components. For those of you who are wondering what an HRA is, it stands for Health Reimbursement Arrangement, and essentially what it is an arrangement for tax-free medical expense reimbursement. As you see on the ledger here, an employer can't technically see what employees are spending their healthcare money on because of HIPAA. So it's like a business expense account, but it's not, because you've got this HIPAA layer in here that requires an employer to keep their employees' medical privacy safe or intact. So it's like a business expense account from how it functions, but you've got all these compliance layers with how you have to offer an HRA. If you're familiar with health savings accounts and flexible spending accounts, the key difference is money made available through an HRA is owned by the employer until reimbursed. So HRAs are not health insurance, and this is key. So a lot of CPAs, or tax advisors, when you start talking about health insurance, they go, "Oh, I'm not licensed to sell health insurance. I can't talk about that." HRAs are not health insurance. They are nothing more than tax vehicles under Section 105 of the IRS Code. CPAs, tax advisors should be talking about these. Health insurance brokers should not be. It's in your territory now. So as employers start switching to this, it really is a CPA or tax advisor, tax professional sale, or implementation, or question to answer, not a health insurance broker's. The health insurance broker needs to focus on health insurance. So to kind of imagine what an employee's experience might be from if you're trying to get an idea of what it looks like in your head, imagine having a balance that you log into every month that accumulates, and having pending claims for reimbursement. Basically, you submit medical expenses or health insurance premiums that you have on your own. You get reimbursed for them, and these reimbursements that are due get added to your paycheck 100% tax-free. Really, really that simple. So quick overview of the benefits. The employees are going to save 20 to 40% on medical expenses by using pre-tax rather than after-tax dollars. The individual health insurance plan is going to let options are going to let the employees choose any plan from any carrier that they want. They'll pay for the money, pay for it with their own money and get reimbursed tax-free. But they can pick whatever deductible level they want to, so full choice. And if they want to buy coverage, supplemental coverage like dental, vision, or vision insurance with pre-tax dollars, they can. The health insurance decisions are handled on an employee level or an individual level with a health insurance broker. The benefit decisions on the employer is handled by the tax advisor or the CFO. So HRAs are going to help reduce the amount of the company's FICA tax because these aren't going to be considered as wages, these reimbursements. They can recruit new employees with a health benefit offering because remember, as long as health care, its reimbursements are tax-free, they're going to be more valuable to an employee than taxable salary. And then increase employee retention, they're going to be able to increase employee retention by providing tax savings for increased employee compensation. So the key thing here is that that health insurance is going to, right now people are confused because they don't view health insurance as a form of compensation. They view it as a rite of passage if you're an employee at the average company. Eventually that's going to go away. It's not going to be a rite of passage. You're going to be required to go buy your own health insurance policy. The compensation, though, is going to be a dollar amount that is tax-free that you view as, hey, that's why I want to work here because this company is giving me $300 to go buy my own health insurance policy. So why we need HRA administration, I only call this attention here. A lot of CPAs try to self-administer and tax professionals try to self-administer an HRA by themselves. Please don't. We have to fix a lot of mistakes here as we come across them. CPAs and tax advisors are great at the tax and the IRS issues, but that's not all that applies to HRAs. So pay attention to the compliance piece here. ERISA, HIPAA, and ACA, you got to comply with these. The employer can't know what they're reimbursing. The ACA puts a lot of new requirements on HRAs that need to happen automatically, such as the SPCs and what do they call it? And making sure the plan design is done correctly. Also, certain limitations on plan design, such as you can't, have cost sharing for preventative care. So all these things need to comply for. You guys are going to be really good at doing this IRS piece, but make sure you get with a partner or develop if you're going to do this yourself, develop a process that takes into account these pieces. So you're going to want compliance assistance, implementation support, and annual reporting. This should not be something that you look at as an increased expense and increased duty that loses, that makes you less profitable, your business less profitable. It'll be something that makes you more profitable. You're bringing value to your customers. The technology should automate reports for you. So whatever HRA provider you pick, make sure that it makes your life as the tax advisor or tax professional easier on an annual reporting basis. All right, so now to the part you're all here for. Sorry for that. So let me give you a quick overview of why I went through that. So in order to understand why you need to know all of this and all these tax penalty stuff is most employers, if they have, if any of these apply, are going to come to you saying, well, what's the value of this penalty for me? What's the value of this credit for me? What's the value of this subsidy for me? And you're going to have to understand and see the future of how employers are going to offer health insurance because it's going to impact how they look at the tax subsidies. If you know that most employers are dropping health insurance in the future or that most employers aren't going to be able to afford health insurance today, you're going to look at the tax penalty calculations and how you give advice on what the tax consequences are a little bit differently. So now we can actually walk through, now that you have the base understanding of where health insurance is going and where health care reform is going from a health insurance point of view, now we can talk about these actual penalties. So we're going to walk through each of these, and I'm going to try to leave some time for questions. Remember, I'm going to give a brief overview of what they are, and then after this presentation, you'll get a link to a page that walks through the actual calculation of these penalties and subsidies, so that you can you can spend more time on this. So, number one, the employer tax penalty for not offering qualified group health. The key definition of qualified means is important. Qualified coverage is something that the healthcare reform defines as meeting minimum essential health benefits requirements. To be qualified, the health insurance plan has to cover certain items. Most of these coverage requirements are expected to increase the cost of employer-sponsored health insurance. So the employer has to offer qualified group health insurance coverage to avoid the maximum penalty. Additionally, they may be eligible for a tax credit for offering group health insurance. Now, the tax credit, in my opinion, is, I don't want to call it a joke, but it's the companies that the tax credit benefit already don't offer health insurance because you have to be really small and you have to have a very low revenue. So it's, you're not going to, I'm interested, after this webinar, tell me about your experiences with the small business tax credit. How many businesses are actually taking advantage of it? My guess is most businesses that can afford to offer health insurance, it's not really a guess, my informed assumption is that most small businesses that offer health insurance don't qualify for the small business tax credit. I'll show you why in just a little bit. Additionally, just because this employer offers qualified health insurance, if it's deemed not to be affordable, they could still have to pay penalties, the tax penalty anyway. So just offering health insurance coverage alone does not exempt an employee from a penalty. It has to be affordable. The key employee tax issues include the tax subsidies on the individual market. This is huge. There's a great calculator at Kaiser that I'll show you before we get off today that helps you calculate these based on household income size. And then the employee tax penalty for not purchasing qualified health insurance. So if an employee decides, hey, I'm not going to buy health insurance this year, what are they going to be paying on their individual tax return and a penalty? So here are the details. So the employer tax penalty for not offering qualified health insurance. The key thing is that it's not applicable for employers with less than 50 full-time equivalent employees. What's a full-time equivalent employees? More on that on the next slide. We'll talk about how to calculate that. So if you have a small business client today that is less than 50 employees, the likelihood is if they employ less than 50 people, they definitely don't have to pay penalties. So the penalty is not applicable. If it is applicable, let's say they have more than 50 full-time equivalent employees, we'll talk about how to calculate that in just a second, then the employer will have to pay, if they decide not to offer qualified health insurance, a $2,000 penalty per FTE, full-time equivalent employee, minus a 30 FTE credit. So let's just say I'm a company that that decides not to offer health insurance, and I have 50 employees, or 51 employees. That means that my penalty, if I'm triggered for the penalty, is 51 minus 30, which is 21 times 2,000. So 21 times 2,000, which what does that give you? That gives you 42,000 annual penalty. So that's how the penalty is calculated. Now, calculating the FTE is a separate thing that we'll calculate, that we'll show you how to do on the next page. The key thing here, you see all these asterisks, 1, 2, 3, 4 asterisks here. Most people think that if a business doesn't offer health insurance, they automatically have to pay the penalty. That's not the case. If a company does not offer health insurance and no employees qualify for subsidies in the individual health insurance exchange, then the employer doesn't have to pay a penalty. This penalty only gets triggered if at least one employee is receiving a subsidy in the individual exchange. The reason for this is that it's really not a penalty. It's a cost sharing. The idea here is that if an employee gets a federal government subsidy on the individual exchange, the employer has a shared responsibility for contributing to that. So there's a chance that let's just say you have a 100-person company and none of them go, let's just say they have really high wages and they all can't qualify for the subsidy. If the company doesn't offer health insurance, that company may not have to pay any tax penalties. So keep that in mind. Next, the employer tax credit for offering qualified group health. It's not applicable for employers with more than 24 FTEs. So if you have if they have more than 24 FTEs, not applicable. Additionally, there is a revenue cap, an annual wage cap on an average annual wage cap for these small businesses. It's not applicable for employers with average annual wages over with $50,000 or more a year. I'm not going to go through how to calculate this. We'll send you a post or an article that walks through the calculation. Most of the key thing to know is in 2004, today the credit is equal to 35% of premiums or the employer contribution of premiums. In 2014, it jumps up to 50% tax credit for premiums for employer-paid health insurance premiums, but that's only available if they go to the SHOP exchange or the Small Business Health Insurance Exchange. Again, that 50% or 35% tax credit scales down as you get bigger. So the 24-person company who averages 49,999 wages, their tax credit is nearly nothing. So the most valuable tax credit is going to be for a one-person company with $10,000 in average wages, which isn't really a company that offers health insurance. So as you get in more detail on this, you'll realize that I think you'll realize that this tax credit is not as valuable. But I'm interested to hear your feedback. You guys are the tax advisors. Employer tax penalty for offering qualified that is not affordable. So finally, on the key employer tax issues, let's say the company does offer qualified health insurance. If it's not deemed affordable, then they still have to pay a penalty. Affordable is defined as if an employee is required to pay more than 9.5% of their income to participate in the health insurance plan, then that is considered to be unaffordable. So if I'm a $10 per hour person, let's say I make $20,000 a year, and let's just say 10% of $20,000 is $2,000, so to round it up. So my minimum, the most I can contribute to the health insurance plan is $2,000. Let's just assume that the annual premium for that person is $20,000 per year for a family of 4. The most I can contribute for my health insurance is $2,000. That means the employer has to kick in $18,000. Most employers don't kick in that now. So the employer, in order to meet this affordability requirement, most employers are going to have to increase their employer contributions to premiums, which most employers can't do already. They're already at the minimum threshold of what they can afford. So if they do not offer health insurance at affordable, they have to pay a penalty. Again, this is not applicable for employers with less than 50 FTEs. The catch here is if they offer a qualified health insurance that is not affordable, they pay $3,000 per employee that goes to the individual exchange to receive the subsidy. So if they offer coverage that's not affordable and the employee opts out and goes to the subsidy, it's going to trigger a $3,000 penalty. Now this penalty, if every employee does it, is capped at $2,000 penalty per FTE with a 30 credit. So they can't pay more than what they pay if they didn't offer health insurance. But key thing is most employers don't offer what's called affordable health insurance today. Most of them are going to start offering affordable health insurance. They're going to elect to either pay this penalty or this penalty. It just depends on how the economics of the health insurance plan work out. The key employee tax issues include the employee subsidies on the individual market. The subsidies are going to be based on employees' income and household size. They scale up to 400% of the federal poverty line. So if you make 400% of the federal poverty line based on your household size, you're going to receive a subsidy. And it's pretty massive. And I'll show you guys a sample calculation of that in just a moment. And additionally, there will be an employee tax penalty for not offering, and this is based on the employee's income and household size. So based on your household size, it's the greater of, and it scales up. I think it caps out at 2.5% of income adjusted annually for inflation. Again, for each of these, we will send you an overview of how to calculate them in detail. All right, so the key variables for businesses in order to calculate these tax penalties, subsidies, and credits is that you have to know the FTE and you have to know the revenue. You guys already know the revenue and the wage pieces. So I'm going to just talk about the FTEs. The FTEs, so how to calculate the FTEs? Here's the formula. FTEs, or full-time equivalent employees, equals the full-time employees plus the full-time equivalent of the part-time employees. The full-time equivalent of the part-time employees equals the part-time hours worked divided by 120. So generally, a full-time employee is an employee who is employed on average at least 30 hours of service per week in a given month. So each month you'll look at the you basically look at the employees, the average full-time employees based on this 30-hour rule. If they work less, they work 30 or more hours per week, that'll count as 1 FTE. If they work less than 30 hours per week, you got to calculate the full-time equivalent of part-time hours and add that to the full-time number of full-time employees. So household size and income are the key variables for individuals. Here's a sample subsidy comparison for you to give you an idea of these massive tax subsidies. So if you make for a family of 4, this is for a family of 4 come 2014. If you make $20,000 a year gross income, let's just assume for a second that your expected total cost for health insurance is going to be $24,000. The annual premium for you is only going to be $0. Why? Because you now qualify for Medicaid. So the government subsidy, in effect, in this case, the tax subsidy is equal to $2,400. Let's just say you make $40,000 for a family of 4. your annual premium is capped at 5.4% of your income. That's $2,178. So let's just assume your expected family cost is $24,000. That means the government tax subsidy that you get is $21,822. I'm not making this up. The tax subsidy that the employee gets at a $40,000 income to buy health insurance is $21,822 a year. At 80, it scales down with income. At 80,000, it's capped at 9.5% of income, so 8,360. So for expected total cost of for a total government subsidy of 15,640. These are considered tax subsidies for purposes of this. It looks like I just covered this. All right, so summaries and next step. The core problem today is that employer health insurance costs too much. So if you take a couple of things away, at the end of the day, employer health insurance costs too much. There's a minimum contribution requirement, and as long as healthcare costs keep going up faster than wages, eventually the employers are going to drop health insurance. The employer health insurance exists in the first place because of a tax deduction. So if you look past health insurance and just look at tax incentives, the whole reason we have employer health insurance is because of tax deductions. The good thing is that employer-sponsored health insurance is now shifting to fixed cost healthcare reimbursements via HRAs. That allows the employer to maintain the tax deduction of health benefits without having to be involved in the health insurance business. In 2014, this is the key point, you're going to be relied on, or tax professionals are going to be called upon to evaluate HRAs, penalties, credits, subsidies, you name it, for businesses and individuals. So depending on who your clients are, you're going to have this conversation to be able to give some advice on it. Hopefully you are prepared. As far as next steps, I highly recommend you get educated on HRAs, because if you aren't telling your business about this right now, you should be, number one, if they don't offer health insurance. And if you're not educated on it now, you need to be, because they're going to start asking you about it come 2014 when people start understanding what HRAs are. And make sure you understand the key healthcare reform tax issues, because the insurance brokers are going to start pushing these questions to you. They're going to say, hey, I sell health insurance. I'm going to meet with your employees. For tax stuff, call your CPA or tax advisor. Excuse me. Finally, once you have all the information, start educating your clients. I think you'll find some increased potential to help them, and they're going to benefit from the education on this. The entire world right now, the entire United States, 99% of the United States, has no idea what healthcare reform is, especially on these key components. So anything you can do to help them figure this out will be an opportunity.